Hey, I'm Dr. Joe Niamtu, LoveThatFace.com. I'm a cosmetic facial surgeon in Richmond, Virginia. I do cosmetic facial surgery from here to here. I don't do boobs, bellies, or butts. I'm a teacher, I'm an author, and I'm a surgeon. Today we're going to talk about laser skin resurfacing. So this is a procedure that remains the gold standard for improvement of facial wrinkles, improvement of sun damage and brown spots, and skin tightening on the face. So in the laser procedure, what we're doing is we're using laser light to actually burn off the damaged layers of the skin. And it does this in microns, very, very small increments, and it creates a second-degree burn on the face. And when this heals, new skin grows back that is lighter and tighter and has more collagen. So it improves the wrinkles, it gets rid of brown spots, and it tightens the facial structures. Now, this is not a tightening like a facelift, but it can do considerable tightening. This is one of the procedures where the recovery is kind of formidable. It's not a procedure that you just say, oh, I'm going to do a laser and go about my business, because it is a facial burn. And a lot of people do laser awake, okay? And they have to do sometimes 2, 3, 4, 5 procedures to get the result. All of my patients are sedated, so we can do this treatment in a single procedure. Now, the first week, patients are going to be raw, and they're going to have Vaseline over their lasered areas, and we're going to show you actual patients talking about this at various stages after their laser. And you'd think it'd be real painful, but I've had it done myself. It's, it feels like a sunburn at first, but really the pain is not a big function or not a big situation with this. I would say patients have mild to moderate discomfort at first. So for 1 week, you're in that kind of raw, greasy phase, and then the new epithelium, the outer layer of the skin, is starting to grow back by a week. And then it becomes much easier. You don't need to use Vaseline or similar greasy substances. You just use a hypoallergenic moisturizer. And usually patients are back in makeup, female patients, by anywhere from 7 to 10 days, depending on how deep our laser treatment is. And having said that, so for people that have deep wrinkles, we're going to treat that heavier. For patients that have less sun damage or less aging, we'll treat it lighter. So a lighter laser may heal totally in a week, and a deep laser may take closer to 2 weeks. So it is a procedure that you have to kind of work your schedule around, and this is one of those procedures where the doctor can do a really good job, but the home care and the cleanliness and the creams and the face washing and everything is really important that the patient follow our instructions. So I've done over 1,100 full face laser resurfacing in the last 20 years, and it's a great procedure, and I'm going to show you some actual footage, some patient interviews, and some before and after pictures. So stay tuned. I'm Dr. Joe Niamtu, LoveThatFace.com. And this is one of my favorite patients. She is 24 hours after upper and lower eyelids, comprehensive facelift, and full face CO2 core laser. And she looks really good. She might not look good to you, but she has pretty typical laser post-op situation. Her earlobes are very swollen. That happens sometimes during facelift surgery, and that will go down. But honestly, she's doing well, feeling well. Tell us a little bit about your night.
Well, I was so surprised about my mobility, because I was up walking around, and I just knew I was going to be more beautiful. So it was just worth it.
And were you in much discomfort?
I had some discomfort, and I took my medicine, and that helped me. And I loved the ice. The ice, that was fabulous.
That certainly helps after
Yes,
laser.
it did,
And
it did.
but you had trouble sleeping, right? That was your biggest thing.
I did not sleep too much. No.
And that's not uncommon the first night after. How you feel? Tell them how you feel.
I am absolutely amazed because, in all honesty, I've been agonizing for 2 months about the intense burning. Gonna burn my face off, and I have just been lost sleep over it. I've had no burning. No burning. I am absolutely astounded. And I don't even know what to say. It's nothing.
So this sounds like an infomercial, right?
It sounds like an infomercial. I'm being honest with you. I'm astounded.
Because she really was, in fact, extremely apprehensive
Yes.
about what was going to happen. And I think this is representative of the newer fractional lasers that have the ability to treat 80% of the skin, yet treat it deep enough where you're getting a very similar result to the old-fashioned lasers that really produce the great
If
results.
I feel anything, it's a little dry prickliness, but that's it.
Well, very good. And I hope all our patients can do this well. I'm Dr. Joe. Well, here we are at 1 week after full face CO2 laser, comprehensive facelift, upper lids, lower lids. And how we doing?
We're doing fine, doing well. I'm happy with my results, and I'm just happy to know that everything looks the way it should look.
Well, it looks the way it should look, and of course, it looks bad when you do this. When you do this much stuff, and the laser adds so much to it. And because she has had this laser, she has goopy skin on her face, and she's red and she's puffy. But it's that laser that's going to provide really nice, smooth skin and improved wrinkles and get rid of all the brown spots. So she's going to have some real big changes in about the next 4 days. So next time we see you in a week or two, we'll revisit that. How are you taking care of your face right now?
I'm using the special soap twice a day, just using my hands very gently, and then I'm using the Aquaphor or the Vanna cream all over, keeping it moist. I'm using the vinegar and the water for discomfort to make it feel better.
Right.
And that's about it.
Very good. Vinegar soaks are very important when you do laser because it kills bacteria, it balances the pH, and it helps get these little crusts off. The other thing we tell our patients, don't sleep with pets, okay? That's something you really don't want to do after cosmetic surgery. Are you showering?
Every day I've
Yeah.
been taking a shower and just using the baby shampoo and just letting the water run over top of me. And
Well, you are a work in progress, and we'll check back in on you. Today, here, we're 8 weeks, so we're 2 months after comprehensive facelift, upper eyelid surgery, lower eyelid surgery, and full face CO2 core laser resurfacing. And so she is just doing excellent, and I'm so proud of you, and this is why I love doing what I do, because when we operate on somebody, obviously, you do a laser, they're burnt, they're swollen, and when you start to see the final product coming into view, it's exciting for both of us. So how have your experiences been here? You just
well, I'm so happy with the way I look. The other night I had, and all of my girlfriends were all in our 70s, and I had 5 of them over for dinner, and I've known them for 50 years. They were so excited about my face. They said, "Oh my goodness, you look like you're 50 years old." And it's just made a big difference. I'm just delighted with the way I look.
Let me ask you a very important question. You had 5 women there. Did you give them my card? No.
I tell everyone.
I'm
No,
just
I
kidding.
tell everyone. I said, well,
I'm just kidding.
because, well, we know you're the best.
Oh, listen.
So I'm glad that I was able to have you.
Well, I'm glad I was able to have you. So we did a lot of, eyelids, laser, facelift. How was that recovery?
The recovery, it takes a few days, but it's
To
just,
say the least.
yes, it's just been well worth it.
Great.
It's just well worth it.
Yeah, and when you do cosmetic surgery, especially when you do multiple procedures, it's like the the cocoon to the butterfly, and it just takes a while to heal. But once it does, it's so rewarding. Part of my job is so rewarding to see people come in and they're just happy. Sometimes you just get your car washed and you come out of the car wash and you feel good just because something's nice or newer or cleaner. And this is a very, about 100 times that. It's going to last for a long time because, you know, we're still going to age, but you have turned the clock back, and it's patients like you, again, that make my job so well. So we want to really thank you for being such a good patient.
Just thank you.
And we'll come back in a second and we'll look at her incisions. Now, we usually don't see patients for another month, but because of vacation, she's coming in a little bit early, and you can see that her incision is healing quite nicely. And in another 4 to 6 weeks, you won't even see where that incision was. And same thing over here. It's so important. You can see we did not change her sideburn. You see a lot of patients that get scalped because the surgeon doesn't know how to manage that. And our incisions here, it's just going to look perfect. And again, behind her ear, it's still a little bit red, but over the next weeks here, it'll be fine. So I'm just so pleased with this case. I'm Dr. Joe Niamtu, doing what I love, and lovethatface.com.